So I'm going to talk to you about the skeletal anatomy relevant for the articular branches of the hip joint. To scan the hip joint articular branches, you start at the anterior superior iliac spine, moving down into the anterior inferior iliac spine. Once you look for the anterior inferior iliac spine, you will be turning the probe along the inguinal crease, looking for the iliopubic eminence and the anterior inferior iliac spine. Skeletal anatomy wise, just below the anterior inferior iliac spine, you will find the iliopsoas tendon. The lateral part of the iliopsoas tendon is where the femoral articular branches to the hip joint are located. Medial to the iliopsoas tendon is where you have an accessory obturator nerve articular branches that are located. To use the ultrasound for this procedure, your scanning technique would be starting with the anterior superior iliac spine, moving down to the anterior inferior iliac spine, turning the probe along the inguinal crease, and once you have seen the probe along the inguinal crease, the needling technique will be in plane, going from lateral to medial, putting the needle lateral to the iliopsoas tendon. Once you have deposited 2 ml of local anesthetic for the diagnostic block, you can then relocate the needle medial to the iliopsoas tendon, injecting another 2 ml of local anesthetic for the diagnostic block of the accessory obturator nerves. Once you have targeted these 2 branches, then the next one that will be the obturator nerve. Now we know the obturator foramen is where the obturator nerve will pierce and supply to the hip joint. To locate these branches, the technique will be very much similar to what you do for the intra-articular hip joint injection. You will place the probe, look for the intra-articular space, and then you will move the probe medially till the femoral head disappears. Once you have located only the acetabulum, you will then move the probe medially and turning it by 15 degrees, looking for the inferior portion of the acetabulum, and this is where you will have the articular branches of the obturator nerve. And the way to perform this block will be in plane, going from inferior to superior and injecting the local anesthetic and steroid. I always perform x-rays for this procedure in addition to ultrasound. I describe this as a combined ultrasound and fluoroscopy technique or cuff technique, where once the needle is located, you will do an x-ray and then fine-tune the needle and locate and place the needle what we call the lateral edge of the teardrop, which you will see on the x-ray imaging. I'm going to talk to you about the articular branches and the pericapsular nerve group block for the hip joint pain. The starting point would be patient laying supine. Palpate the anterior superior iliac spine. You will be putting the ultrasound probe at the anterior superior iliac spine and moving down, looking for the anterior inferior iliac spine and moving the ultrasound probe along the inguinal crease. So we're starting here on the ultrasound image here. I'm going to reduce the depth. And here we have anterior superior iliac spine. I'm now going to move. When you move downwards, you will have another structure coming into the image. That's the anterior inferior iliac spine. Once you have the anterior inferior iliac spine coming into the view, as I mentioned, we will be moving the ultrasound probe along the inguinal crease. And here I'm going to reduce the depth, showing you the image of the iliopsoas tendon along with the iliopubic eminence and the anterior inferior iliac spine. So on the ultrasound image here, we have the anterior inferior iliac spine. This is the iliopubic eminence. This is the iliopsoas tendon, which is formed inside the iliopsoas muscle. When you bring the needle and put the needle lateral to the iliopsoas tendon, that will be your femoral articular branch to the hip joint block. When you bring the needle and put the needle next to the iliopsoas tendon on the medial side, that will be accessory obturator nerve block. If you bring the needle, pierce the iliopsoas tendon and put the 20 ml of local anesthetic, and that is your pericapsular nerve group block. The volume decides the block. To perform the diagnostic block, the volume of the local anesthetic will be 2 ml for the femoral articular branches, 2 ml for the accessory obturator nerve. So this is the peng block along with the femoral articular branch block and the accessory obturator nerve articular branch block. We are going to move on to the obturator nerve articular branches. To locate these, you will be looking for the image that we use to perform the hip joint injection, focusing more on the acetabulum. Once you see the acetabulum, you keep going medially, looking at the acetabulum, and here we will be moving the ultrasound probe medially so that you will only see the inferior surface of the acetabulum, and this is where will be your target, bringing the needle in plane from distal to proximal and putting the needle at the base of the acetabulum, which coincides it with the incisura of the acetabulum. Always put a color Doppler because you will be locating the neurovascular structure here on the top, and you really want to avoid the neurovascular structure. Hence the use of ultrasound is an advantage, as you will prevent the vascular injury by locating the artery and guiding your needle and preventing the vascular injury.